Some really bad things can happen, and some people can really be put in some really difficult and horrific situations.
Across the country, adult protective services agencies investigate claims of emotional and physical abuse, neglect, and financial exploitation of older adults. But in Utah, advocates say the system may not be catching everything it should.
We're clearly missing something.
I'm investigative reporter Taylor Stevens. Data shows Utah's APS is substantiating a far smaller percentage of claims than the national average, raising questions about whether vulnerable older adults are receiving the protections they need.
Abuse of older individuals is a complicated situation. Many don't want to talk about it.
As our Care in Crisis series continues, we examine why Utah confirms so few complaints and what makes these cases so hard to prove.
One of the things that we look at a lot is what's called self-neglect, where people just may not be taking care of themselves.
Nels Holmgren directs Utah's Adult Protective Services, which receives about 5,500 complaints of elder abuse, neglect, or exploitation each year.
Another growing one that we have is financial exploitation.
Investigators also look into cases Holmgren describes as rare but horrifying, like physical and sexual abuse.
Those do happen, and those are ones we investigate.
Following an investigation, APS caseworkers determine whether an allegation is substantiated, disproven, or inconclusive. And in Utah, the vast majority of cases fall into that last category.
They substantiate a very small number of claims, well below the national average.
Nate Krippis is an attorney with the Disability Law Center who's concerned about the quality of elder abuse investigations in Utah. After hearing his concerns, I asked APS for data on its investigations and found nearly 80% of all cases are deemed undetermined or inconclusive. Since 2019, Utah has substantiated an average of just 5% of cases, a number experts say is far too low to reflect reality. Nationally, the average is 29%, according to a 2021 report prepared for the U.S. Department of Health and Human Services that covered 36 states.
That would raise red flags to me extremely, that it's so much significantly less than the national level.
Sam Brooks advocates for better nursing home conditions through his work at the National Consumer Voice for Quality Long-Term Care. He believes Utah's substantiation rates don't reflect the true scope of elder abuse, which is frequently underreported nationwide.
When you have that small number of substantiation and that really significant number of inconclusive, that's very concerning.
I do have some level of concern about the investigations being done.
For Krippis, data showing so many cases are undetermined or inconclusive raises the questions of whether APS conducts thorough investigations. He says he's seen cases where investigators get different stories from an alleged victim and perpetrator and then end the inquiry.
It's like, well, we can't substantiate.
There's more to it than that.
Holmgren says APS investigators work closely with law enforcement partners and the Office of Licensing when needed,
to make sure that it's not just a he said, she said, and looking at patterns and things like that.
He told us he isn't concerned about low substantiation rates in Utah compared to nationally, pointing to differences in state laws around elder abuse investigations and to the limited scope of Utah's laws.
I do know that the bar is high in Utah, and again, I think policymakers in the state are very cautious about getting too involved in the lives of adults.
Holmgren also notes investigators face unique challenges when attempting to substantiate these cases.
Sometimes the older person is hesitant to pursue that because it is a family member.
Some victims may lack cognitive capacity to work with investigators, and alleged perpetrators in elder abuse investigations aren't legally required to participate.
And it can be really difficult if that person is not cooperative.
APS says high turnover and heavy caseloads also pose challenges for investigators. Records from the Department of Health and Human Services show that in the first half of last year, APS investigators in some positions handled more than 40 cases a month on average, almost triple the recommended load.
We're certainly aware of that issue and are working with executive and legislative branch partners to make inroads on that.
In 2024, the governor's budget recommended additional funds be set aside to hire new caseworkers and help reduce caseloads. But the legislature didn't approve it.
There were many requests that were not funded, but it's certainly something that we continue to work at.
In the meantime, Holmgren says the agency is trying to do as much as it can with the resources it has.
We're squeezing as much benefit out of the existing budget as we can.
Krippis hopes that state lawmakers will take a closer look at APS staffing, training, and investigative standards this year, arguing that the state may never uncover serious abuse without proper processes in place.
Ultimately, if something horrific is happening, this may be the only way we're ever going to find out.
Utah law requires anyone who believes a vulnerable older adult is being abused, neglected, or exploited to immediately notify Adult Protective Services or law enforcement. You can file a complaint on APS's website or by calling 1-800-371-7897. Taylor Stevens, Fox 13 News, Utah.